I'm Dr. George Morris, President of the Medical Society of Milwaukee County, and this is the July 2010 President's Newsletter. Recently there's been a number of reports in the newspaper about fatalities associated with medicine overdosage and large amounts of prescription medications that have been made available to individuals that allow that to happen. Here in Milwaukee County, we're very lucky to have a very active District Attorney's Office, and the Chief Deputy District Attorney has agreed to join me today. The Attorney Lovern is here, and we're going to ask him to kind of tell us a little bit about how how Milwaukee County's District Attorney's Office is helping to identify at-risk individuals and try to reduce these overdosage fatalities. Ken?
Well, thank you, Dr. Morris. These cases present a unique challenge for us because, unlike traditional drug cases, this controlled substance involved here is a legal substance, and it can be obtained legally. And so it creates different challenges for us in terms of investigating criminal wrongdoing related to these substances. But as everyone knows, there's been a rapid influx of these drugs used for potentially damaging purposes, and we've seen devastating results as in the last several months, particularly in parts of the community that you wouldn't expect. And the other challenge it creates for law enforcement is the fact that often these drugs are distributed behind closed doors in legal forums, and you're not seeing open-air drug dealing like you might see with controlled substances. So what our office was able to do was obtain a grant to fund a prosecutor specifically dedicated to researching and investigating crimes related to prescription medication. And this prosecutor's position exists for at least a year, and her function solely will be to focus on prescription drug cases. And it'll really break down into two principal areas. Number one, we want to create a database so that we can identify every police contact with somebody involved with prescription medication that appears to be unlawful. So we want to have that person identified, we want to have the controlled substance identified, and we want to have the source of that controlled substance identified, meaning the physician who prescribed it and the pharmacy from which this substance was obtained. We need to do that first. The second then area we'll focus on will be the offenders themselves when they come into police custody, and we'll break those people down really into two categories. The category first of those people who have genuine substance abuse issues, who are principally hurting themselves, and who we can try to divert into a program of rehabilitation to prevent them from engaging in this type of behavior again. The second category of people will be those who are hurting others by distributing this. And unfortunately, we do have people who are drug dealers of prescription medication, either by stealing it from family members or by falsely obtaining prescription medication through a pharmacy. So those will be the two categories that we break down offenders. And those offenders who are distributing to others will take a much more aggressive position on with regard to sentencing and prosecution. Those who we think are genuinely battling an addiction, we will try to divert into treatment programs. Where we think we can really interface with the medical community is by having your assistance in determining where certain offenders may fall. Because it's difficult for us to determine just on the face of the substance involved here whether it's an amount used for personal use by somebody who's just abusing a drug, or whether it's an amount that would be consistent with distribution to others. And so we'll look forward to working with your medical professionals in determining what constitutes abuse by one person versus delivery to others. And the other, quite frankly, the other angle we'll be seeking your assistance on will relate to those medical professionals who may not be prescribing or may not be distributing in accordance with medical standards. And we know that that number is fairly few as it relates to the entire medical community, but it's important for those people to be identified and for that behavior to stop.
Absolutely. As you know, we've actually worked on a project to establish a medicine management agreement so that physicians, particularly those treating painful conditions, have an ability to have someone sign an agreement, and then that will become available to, for instance, the emergency departments in the county, so that they're in a position of saying, look, you already received medication from Dr. So-and-so, you shouldn't be here asking us for more. So we kind of clamp down on that. And the AED committee is also working on giving you some guidelines. setting some guidelines about appropriate prescriptions for pain medicines. And of course, we've also talked about being available. We'll have some of our physicians who are specialized in pain management available to your office, so that when your prosecutor has an issue, she can just pick up the phone and call someone and say, "This is the scenario. Are we flirting with being outside of good practices?"
Mm-hmm. That'll be tremendous. This is an issue that the entire community is grappling with right now, and it's not something that law enforcement officials can solve on our own. And we need the help of the medical community and your expertise that you can bring to this issue to help us address this as quickly and as comprehensively as possible.
Well, that's our hope. And just the most important thing is to make Milwaukee County and surrounding counties as safe as possible.
No question about it.
All right. Thank you.
Thank you,
Mr.
Doctor.
Lovern.
Appreciate it.
Thank you.